July is National Bone Cancer Awareness Month, a time to learn about the latest innovations in treating cancers of the bones and joints. Joining us now, orthopedic surgeon who is at the forefront of all this, Dr. Khachatrian, medical director of orthopedic oncology at Scripps Cancer Center. And doctor, we teamed up like 5 years ago. Nice to see you again.
Yes, very nice to see you.
That was back when we highlighted an innovative procedure featuring patient Rose Trong, and we're going to get into her more in a moment. But let's talk about bone cancers. How common are they? What should people at home know about them?
You know, people, it's a kind of a forgotten disease for many years. Bone cancers are rare, primary bone cancers. When they start in a bone, it's probably about 4,000 people in a whole nation that get diagnosed. So very few centers treat it, Scripps being one of them. And people think that it's never going to happen to them. And oftentimes it happens in very young people, 14 to 16. They have a little ache, it's a little sports injury, it gets ignored. So never ignore a pain that lasts more than 6 weeks is when I want to send the message to the parents, because it is often too late when people come in, and saving a leg or an arm is very hard when the tumor is misdiagnosed for such a long time, which is actually mostly common. 30% come late.
Okay, so someone does feel the pain, a parent says, hey, let's get in and get looked at. What is that process like when you're going through the bones to find something that could be concerning?
So the primary care would order an x-ray, often not showing anything. But I always say, if the pain is there more than 6 weeks, you've done your little workup with physical therapists with your primary, do an MRI. It's a cheap test that's going to find it out, and you're not going to look back and say, I wish I did it.
Yeah, so serious, because once it gets into the bones, doctor, let's be honest, it's tough.
It's tough.
It's a tough diagnosis.
More commonly so, it's the secondary cancer.
Okay, yeah,
so
touch on that.
Every cancer that exists, but most common ones, the breast and prostate, end up at the end of late-stage disease in a bone. And we have about 300,000 people living with bone cancer and dying with that bone cancer, which is secondary. So this is a very serious problem.
What are the treatment options that are available?
For primary bone cancers, it has been really dry out there. So it's been chemotherapy and resection. The best surgery is your best outcome. We're starting to get glimpses of hope, and we're really working on it both at Scripps and in collaborations with UCSD. Working on immunotherapies, working on new drugs, small molecules that will actually signal your system to clear these cancers. But right now, best surgery is your best bet.
Okay, we do want to touch on Rose Trong. We did a story 5 years ago. An ankle bone was used in her shoulder. That was an incredibly innovative procedure. Can you touch base on how she's doing? And I understand she had another procedure, right?
Yeah, so Rose is truly a partner in health. That's what we want. We want our patients to be our partners, seeking for better life for themselves, for better treatments for everyone. So she did great. Unfortunately, her tumor came back, and that is the problem. It came back slightly elsewhere. And you have to start thinking, what can we do to preserve function? So I collaborate a lot with people around the world, and there was some suggestions from Japan that tumors can be frozen, except you can't take out her whole arm and shoulder, freeze it. So we actually used an innovative procedure where we froze it in situ. We use it with Dr. Sabir, who's an internationally renowned interventional doctor. So this is always a teamwork with the patient and with other providers, and we actually froze the tumor.
That's incredible.
And it never came back.
Wow, that's awesome.
It's been 2.5 years. We're praying every day probably about this.
Great.
But
that's the type of forefront you're getting there from Scripps. You guys are ahead of it all. We thank you for everything you guys are doing. Thanks for the update on Rose as well. Where can people learn more if they have a couple more questions?
Well, we have a great website, scripps.org/cancer, and I think there's a lot more in good websites like that you can learn as opposed to some online.
Awesome. Doctor, appreciate everything you and your team do there at Scripps.